Today, we're talking about Celontin. Celontin is used alone or with other medications to prevent and control a certain type of seizure, known as absence or petit mal seizure. It works by controlling the abnormal electrical activity in the brain that occurs during a seizure. The usual starting dose is 300 mg once daily or 150 mg every 12 hours. Your doctor may increase your dose as needed. It's best to take Celontin at the same time each day to help you remember. Always follow your doctor's instructions for the best results. Before you start taking Celontin, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once or twice daily. Your dosage will be based on your medical condition and response to treatment. Your doctor will start you on a low dose and slowly increase it. It may take several weeks or months to reach the best dose for you and to get the full benefit from this medication. Use Celontin regularly at the same time each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. If your condition does not improve or worsens, be sure to tell your doctor. Some common side effects of Celontin may include drowsiness, dizziness, stomach/abdominal pain, loss of appetite, nausea, vomiting, weight loss, diarrhea, headache, or loss of coordination. However, many people using this medication do not have serious side effects. A small number of people who take anticonvulsants for any condition may experience depression, suicidal thoughts/attempts, or other mental/mood problems. Tell your doctor right away if you notice any unusual/sudden changes in your mood, thoughts, or behavior. Additionally, tell your doctor right away if you experience signs of infection, aching swollen joints, rash on nose and cheeks, severe tiredness, easy bruising/bleeding, or rapid breathing. In rare cases, a very serious allergic reaction to this drug may occur. Get medical help right away if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. Always consult your doctor for any concerns about side effects and report any side effects to the appropriate medical authority in your country. Before starting Celontin, make sure to inform your doctor about any allergies to methoxamide or ethosuximide. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. You should also inform your doctor or pharmacist about any history of liver or kidney problems before using Celontin. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can worsen these effects. It's important to avoid driving or using machinery until you can do so safely. Also, avoid alcoholic beverages and talk to your doctor if you are using marijuana. If you are pregnant, Celontin should only be used when clearly needed, so make sure to discuss the risks and benefits with your doctor. It's unknown whether Celontin passes into breast milk, so consult your doctor before breastfeeding while using this medication. When taking Celontin, it's important to be aware of potential interactions with other medications and herbal products. Inform your doctor and pharmacist about all the products you use, including prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Celontin is orlistat. Additionally, be sure to tell your doctor or pharmacist if you are taking other products that cause drowsiness, such as alcohol, marijuana, cannabis, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers. It's also important to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, ask your pharmacist about using those products safely. If someone has taken too much Celontin and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of Celontin overdose may include slow or shallow breathing, severe drowsiness, and loss of consciousness. It's important not to share Celontin with others. While taking this medication, you may need to undergo lab and/or medical tests, such as a complete blood count and kidney/liver function tests. It's important to keep all medical and lab appointments and consult your doctor for more details. When taking Celontin, it's crucial to take each dose at the designated time. If you happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, it's best to just skip the missed dose and continue with your regular schedule. Avoid taking double the dose to make up for the missed one. Remember, consistency is key when taking this medication. When storing Celontin, make sure to keep it at room temperature and away from light and moisture. It's best to avoid storing it in the bathroom or near heat sources like a closed car or steam pipes. Also, make sure to keep it out of reach of children and pets. When it comes to getting rid of Celontin, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the medication when it's expired or you no longer need it. If you're unsure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.